Assalamu alaikum, beta. In this video lecture, I will deliver the lecture on dysplastic nevus. This is the part 2 video of the topic pigmentation disorders and the disorders of the melanocytes. In the part 1 video, I delivered the lecture on freckles, lentigo, and melanocytic nevus. And in this second part, I will deliver you all about dysplastic nevus. Okay. Um yeah, so that's it. Dysplastic nevus. Before I really take you to all the concepts of this dysplastic nevus, yeah, but I first mentioned that the entire lecture is going to be bit from your textbook, Robin Spaces. Okay, so yeah, so dysplastic nevus. For this, you need to understand few things that okay, three things are there. Number one, at the end of the previous lecture, in the part 1, I told you that there is a condition called melanocytic nevus. What happens in melanocytic nevus? There is proliferation of melanocytes in the skin. Okay, yeah. And the condition which we will discuss today, dysplastic nevus, इसमें भी क्या होता है बेटा? There is proliferation of melanocytes. But you know what? What is the difference between these two? In this case of melanocytic nevus, the melanocytes proliferate for a certain period of time, and the later senescence, they do not develop into malignant condition called melanoma. They do not develop into malignant condition called melanoma. So the melanocytes, in case of melanocytic nevus, they do proliferate for a period of time and their proliferation is stopped. Okay, and the melanocytes do not keep on multiplying, so therefore they do not develop into melanoma in case of melanocytic nevus. But yeah, in case of dysplastic nevus, there is proliferation of melanocytes and there is no break to melanocyte proliferation. So they keep on proliferating and one day they develop into malignant condition called mela, melanoma. Melanoma. Okay. One day they develop into condition called melanoma. Are you clear with this thing, beta? If I quickly recap the same thing again, that the previously we discussed the melanocytic nevus, in which there is proliferation of melanocytes, and in dysplastic nevus there is proliferation of melanocytes. So same. And then what's the difference? The difference is the proliferation of melanocytes is then controlled in case of melanocytic nevus, so therefore it does not develop into melanoma. But in case of dysplastic nevus, the proliferation of melanocytes has no break later. So it keeps on proliferating and ultimately it develops into a malignant condition called melanoma. Okay, so that's the thing. Yeah. Okay, let's have few more words about dysplastic nevus. Now we will keep on, getting into the details of the topic dysplastic nevus. By the way, there is a condition called dysplastic nevus syndrome. Okay, dysplastic nevus syndrome, that is DNS. This is an autosomal dominant, yeah, autosomal dominant inherited disorder. Autosomal dominant inherited disorder. What happens in this disorder? Dysplastic nevus syndrome. What happens is two conditions are co-inherited. Number one, dysplastic nevus, and number two, melanoma. Okay, these two conditions are inherited, right? And uh, probability that patient with DNS will develop melanoma is over 50%, especially if you are in the age of around by the age of 60 years. Okay, yeah. So it is possible that if I describe the same thing in easy language, then I'll say dysplastic nevus syndrome, DNS, is a condition that is actually the autosomal dominant inherited disorder in which these two pathological conditions of the skin are co-inherited. So people at the same time develop dysplastic nevus and melanoma as well. Okay, now you are clear with this basic concept and the concept of dysplastic nevus syndrome. Dysplastic nevus syndrome, in very easy words, you can remember that dysplastic nevus syndrome is the condition in which what happens, people develop people are co-inherited with two conditions. One is dysplastic nevus, one is melanoma. Okay, the topic for today is going to be dysplastic nevus. Okay, yeah, let me take you a little further in this topic. Okay, Beta, I will now onwards explain you the pathogenesis of the dysplastic nevus. But for explaining the pathogenesis of dysplastic nevus, we have to recap the pathogenesis of melanocytic nevus. Yeah, I hope you haven't forgotten and you have watched the previous video. So let's first quickly recap the melanocytic nevus key pathogenesis to have the better understanding of pathogenesis of dysplastic nevus, right? What happens beta in case of pathogenesis of melanocytic nevus? Yeah, you remember? There was NRAS gene और उसके डाउनस्ट्रीम पाथवे में आता है yeah, BRAF gene, if I'm not wrong, serine threonine kinase BRAF gene. You can even follow the same thing from your textbook. You can see, you can read, same thing is written. So this is the downstream of NRAS. NRAS is the first component with which this entire thing starts, and the downstream of the NRAS is BRAF. And after so many molecules in this stream, in this pathway, there comes yeah, let me quickly tell you, cyclin dependent kinases 4 or even 6, and ultimately in the end you have increased growth and proliferation of melanocytes. Okay, easy life, and I hope you better understand this. This is the pathogenesis of melanocytic nevus, and this is how the melanocytes keep on growing and proliferating. So the number of the melanocytes is increased and people develop melanocytic nevus. Okay, but you know what beta, this does not develop into melanoma as we have discussed it so many times. Why? Because this growth and proliferation of the melanocytes is in case of melanocytic nevus. This growth and proliferation of the melanocytes is later stopped. How? Let me tell you. Okay, this is the last thing which is actually proliferating the growth and proliferation of melanocytes, the CDK4 and 6. You know beta, what happens later? Two nice little babies come in the competition, that are two tumor suppressor proteins P16 or INK4A. They too actually inhibit this CDK, cyclin dependent kinase 4 or 6. So guess what happens when these two are inhibited? When these two are inhibited, there will be no more growth and proliferation of melanocytes, and this is the reason melanocytes do not proliferate further and they do not develop into melanoma. Okay, this is the case of melanocytic nevus. But yeah, now let me tell you what happens in case of dysplastic nevus. In case of dysplastic nevus. Okay, yeah, so I mean, look, same thing happens in case of dysplastic nevus as well. Same thing happens, like it starts with the same pathway. There may be okay, in case of melanocytic nevus, there is gain of function mutation in this, gain of function mutation in this. Okay, due to which this pathway is actually increased. Okay, but let's see what happens in dysplastic nevus. It all starts with NRAS, same way the melanocytic nevus started. Okay, and there is downstream pathway called BRAF, and there may be some other downstream pathways, but we directly jump to cyclin dependent kinase 4 or 6, and then we have growth and proliferation of melanocytes. Okay, the same story is there as it was in melanocytic nevus, gain of function mutation in NRAS, gain of function mutation in BRAF, so this pathway is increased. If this is activated, if it is having gain of function mutation, or if it is having gain of function mutation, so this pathway will be increased actually, resulting in increased growth and proliferation of melanocyte, and you will develop dysplastic nevus. Then okay, what is the difference, beta? Look, so far both are looking very much similar. I can't see any difference between two. Yeah, but the difference now I will show you is this dysplastic nevus, it does develop into melanoma. Okay, you know why this did not and this is developing into melanoma? Is, now let me tell you the difference between the pathogenesis of melanocytic nevus and dysplastic nevus. There is one thing very important. Look beta, अगर कुछ यूं हो जाए कि साइक्लिन डिपेंडेंट काइनेस 4 और 6 को ये P16 और INK4 आके इनहिबिट कर दें, तो फिर क्या होगा? ग्रोथ एंड प्रोलिफरेशन मेलानोसाइट्स की रुक जाएगी और ये मेलानोमा में डेवलप नहीं करेगा। लेकिन डिस्प्लास्टिक नेवस के केस में क्या होता है, जो आपका साइक्लिन डिपेंडेंट काइनेस 4 और 6 होते हैं वो म्यूटेटेड होते हैं, कुछ इस तरीके से म्यूटेटेड होते हैं कि these P16 and INK4A are unable to inhibit this cyclin dependent kinase 4 or 6. Understand? In case of melanocytic nevus, CDK4 or 6 they were normal. So P16 and INK4A they were just coming and inhibiting the cyclin dependent kinase 4 or 6. Okay, so once these cyclin dependent kinases are inhibited, the growth and proliferation of melanocytes is inhibited, so no melanoma development, no malignancy development. But in case of dysplastic nevus, this nice little thing CDK4 or 6, they are actually mutated in such a way that P16 or INK4A are unable to inhibit this downstream pathway of cyclin dependent kinase 4 or 6. So once P16 and INK4A are unable to inhibit this entity, say CDK4 or 6, so this pathway is not going to be stopped. If this pathway is not stopped, so melanoma is for sure going to be developed. Okay, so in case of dysplastic nevus, these are the mutations. By the way, some other mutations may be there that may participate in the growth and proliferation of melanocytes. Include some other mutations. They include like a loss of function mutation in a tumor suppressor gene, that is your cyclin dependent kinase 2A. okay, this is another separate gene. This is a tumor suppressor gene जिसमें loss of function mutation हो जाती है, जिसकी वजह से melanocytes की growth and proliferation होती है. okay बेटा, yeah, that's the thing. Okay, in your textbook beta, one more mutation is given other than these mutations, that is also participating in the increased growth and proliferation of melanocytes, that is increased expression of TERT gene. Increased expression of what gene? TERT gene. This will also increase the growth and proliferation of melanocytes. Actually, TERT is the gene which normally encodes telomerase enzyme, and telomerase enzyme is the enzyme which actually prevents cellular senescence. सेल्स की सेनेसेंस को बचाता है, सेल्स को ओल्ड एज नहीं होने देता, सेल्स को telomerase is kind of enzyme which keeps your cells very much young. Telomerase is enzyme which keeps your cells very much healthy. Okay, so TERT is the gene actually which encodes telomerase enzyme. And guess what's going to happen if there is increased expression of TERT enzyme? When there is increased expression of TERT enzyme, so lots of telomerase will be producing. So that lots of telomerase is going to do what? It will keep yourself it will keep your cells active, healthy, and every time replicating and proliferating. So this is how melanocytes, they will keep on proliferating and they will develop dysplastic nevus. Okay, so I hope you are clear with the pathogenesis of dysplastic nevus. Okay, now let me take you to the morphology part of dysplastic nevus. Okay, yeah, morphology of dysplastic nevus include beta. In this morphology part, we will discuss about the lesion that appears on the skin. What was the pathogenesis? There is actually increased proliferation of melanocytes which is uncontrolled. So when in the skin, inside, melanocytes proliferate, especially in case of dysplastic nevus. How does lesion appear on your skin? How does it look? What is its appearance? So let's talk about the lesion that appear on your skin. Let's talk about the lesion that appear on your skin in case of dysplastic nevus. The lesion is it's a macule, if I say, if I'm not wrong. Yeah, you can see in your textbook as well. It is a flat macule, or even it can be I can say slightly raised plaque. Slightly raised plaque. Okay, slightly raised plaque. Yeah. If I talk further about this lesion, then you will see that इसकी जो surface होती है वो थोड़ी peeble होती है, ठीक है, marble like होती है, and it is a pebbly surface, and it is the lesion is more target like. I will show you the lesion for sure. और इसका जो lesion का जो center होता है बेटा, yeah, the center is a little bit raised, and the boundaries are irregular. Okay, so center is little bit active and raised. Okay, and the center is, by the way, dark as well. And if I talk about its periphery, the periphery of the lesion is gonna be it's not raised. The periphery is flat, and by the way, it is very much irregular. Now it's time, I think, to show you the lesion. Yeah, can you see this lesion, beta? Yeah. Can you see that this is the lesion? I think this is a flat macule, but in few cases you will see some dysplastic nevi are, kind of plaques. Okay, isn't it more like peeble? Isn't it having pebbly surface? It is. And isn't it looking more like a target? Okay, the center target like this. Okay, and the center is a little bit raised. I don't know if you are getting it or not, but I hope you people are very much intelligent and you can get what I'm trying to say. The center part is a little raised and little darker. If you do not find this picture very much informative, you can search some different pictures as well. You can even see it in your textbook. But as per your textbook, and for your knowledge, the center of the dysplastic nevi is going to be a little raised and darker. The periphery is going to be flat and irregular. Periphery is actually very much irregular, and it is actually flat, not raised. Center of this lesion is raised. Okay, these are the things you have to keep in your mind, and this lesion is not more than 5 millimeter. Okay, 5 millimeter or just around 5 millimeters, 5 to 10 millimeter is the range which is considered. Okay, yeah. And by the way, this is not single in number. There may be hundreds of these lesion, maybe hundreds. Okay, maybe hundreds. What did we discuss so far? I told you that the lesion in case of dysplastic nevi may be a flat macule or a little raised plaque. Surface is very much pebbly. It's more like a target lesion, not complete target lesion of erythema multiforme. इसमें तो complete target बनता है, लेकिन it's looking like a target like lesion. But okay, the center is little much raised, and the center is bit darker. Periphery is flatter and irregular. Okay, is 5 millimeter or greater than 5 millimeter. Okay, as per your book, and there may be hundreds on your skin. Okay, and yeah, what else? There is variability in the pigmentation. Yeah, there is variability in the pigmentation, as I mentioned, that the center is dark. Okay, center is little darker, and the periphery is little lighter. Center is little darker, and periphery is little bit lighter. This variability in pigmentation, is called variegation. Okay, you can find this term in your book. Variegation. Can you see? the center is dark and the periphery is light. This variation in the pigmentation is called variegation. Okay, yeah. As I mentioned that, by the way, your dysplastic nevus syndrome, most of the cases they are inherited, autosomal dominant disorder, and in few cases they may be congenital. Okay, congenital, yeah. So far I told you that this may be a flat macule or a slightly raised plaque. Surface is very much pebbly. It is looking like a target. Okay, we talk about the center. It is little raised and it is darker, and the periphery of the lesion is little lighter and it is flat. Okay, yeah, it is 5 millimeter or more. It may be hundreds on the skin, and this variability in pigmentation, in the center it is little darker and the periphery it is little lighter. This is called variegation. Okay, and where does it appear on the skin? It appears on the skin like on both, you know, surfaces of skin. Where should I like this? Like this. साइट क्या होती है बेटा इसकी? ये सन एक्सपोज्ड स्किन पे भी बनता है, सन एक्सपोज्ड स्किन पे भी बनता है, और जो सन प्रोटेक्टेड स्किन है वहाँ पे भी बनता है, सन प्रोटेक्टेड स्किन पे भी ये बनता है. ओके, not only in the sun exposed skin but can appear on the protected skin as well. What else? Yeah, let me tell you. Okay, if you now see, if I take you a little bit deep into the skin, then you can see that this is the epidermis and below is the dermis. Okay, and here are the, at the very much lower layer there are the basal cells. But you know what, in the basal layer you have melanocytes as well. At few places you have, okay, let's suppose these are the basal cells, these are the basal cells everywhere. This is the lowermost layer of the epidermis, but at few places you will see, at few places you will see there are some, yeah, there are some melanocytes. And you know what is happening in case of dysplastic nevus? These melanocytes will be multiplying very much, they are proliferating very much. So what will happen, they will proliferate as much that they will completely replace this basal layer. The cells in basal layer will be completely replaced with the melanocyte. One nest of the melanocyte, one nest of the melanocyte is actually fusing with another nest of the melanocyte. So these nests of melanocyte keep on fusing with each other. Another nest of the melanocyte, another nest of the melanocyte. So these nests of the melanocyte keep on fusing with each other. So they actually completely replace the basal layer. Okay, so now the basal layer is completely replaced with the melanocytes. So this type of hyperplasia, when these nests are linearly growing and replacing the basal layer, this is called lentiginous hyperplasia. Lentiginous hyperplasia, the term in your book, lentiginous hyperplasia, that is the pattern of hyperplasia we learned in case of lentigo as well. If you have watched the previous video, you will learn lentigo. उसमें भी ऐसे लीनियर फैशन में हाइपरप्लेजिया हो रही थी, और यहाँ डिस्प्लास्टिक नेवाई में भी क्या हो रहा है, जो सेल नेस्ट है मेलानोसाइट के, वो एक दूसरे के साथ लीनियरली फ्यूज करके आगे बढ़ रहे हैं, एंड दे आर ग्रोइंग, दे आर अंडर हाइपरप्लेजिया, एंड दे आर ग्रोइंग एंड fusing with adjacent nest in this fashion, linear fashion. Okay, so this pattern of hyperplasia is called lentiginous hyperplasia, by the way. Yeah, are you clear with this, beta? Okay. What else? This is epidermis, by the way. Epidermis till here, this is epidermis, and this part is dermis. Okay, this part is dermis. In case of dysplastic nevi, you will see some changes in the dermis as well, especially in superficial dermis. You will see some lymphocytic infiltrates in superficial dermis. This is superficial dermis, by the way. This is superficial dermis, so you will see some lymphocytic infiltrates as well. Yeah. Okay. These are melanocytes, na, which are proliferating very much. By the way, these melanocytes are also known as nevus cells, because they are very much proliferating, and we are obviously studying dysplastic nevi. Dysplastic nevi is the condition in which there is uncontrolled multiplication of these melanocytes. So these melanocytes are also called nevus cells. Dysplastic nevus cells. So by time what happens, these melanocytes, when they keep on proliferating, so older cells, they die. When the older cells die, if let's suppose this is the latest cell, these are the latest cells which are now proliferating, and this is the older cell, okay, and इसने अपनी ज़िंदगी का बड़ा हिस्सा गुजार लिया है. अब क्या होगा, ये इसकी लाइफ स्पैन कंप्लीट हो जाएगा. जब डेड हो जाएगा बेटा, तो क्या होगा, इसके अंदर जो मेलानिन फिल्ड था वो मेलानिन रिलीज हो जाएगा. वो यहाँ से मेलानिन इसके अंदर से रिलीज हो जाएगा. सारे बेटा जब सेल की डेथ हो जाएगी तो इसमें से मेलानिन रिलीज हो जाएगा. इसमें से मेलानिन जब रिलीज हो जाएगा तो दिस रिलीज ऑफ मेलानिन फ्रॉम द डेड मेलानोसाइट्स इज कॉल्ड melanin incontinence. What is melanin incontinence? Melanin incontinence, spelling is obviously not correct, but I hope you understand what I'm trying to say. Melanin incontinence is loss or release of melanin from where? From dead nevus cells. From dead nevus cells, or I can say dead melanocytes. Obviously melanocytes have to die here because they are very much older here. Okay, here are the latest melanocytes which are now proliferating and rapidly growing. These are little older. They have had their life. Okay, so now they are died, and once these cells are died, so they will release melanin, and that was actually stored inside them. So this release of melanin is called melanin incontinence. Okay, and this melanin which is now released will be later phagocytosed by dermal macrophages. Okay, yeah. Okay, this is the lymphocyte infiltrates in the superficial dermis, and this melanin is actually phagocytosed by dermal macrophages. And one more thing that you will notice in case of dysplastic nevi is linear fibrosis surrounding rete ridges. Okay, these are the rete ridges which are coming down into the dermis. Okay, you will come to see some kind of fibrosis around. Fibrosis around these rete ridges, hard fibrotic tissue around these rete ridges, and this fibrosis is actually initiated and induced, or I should say triggered, by these nevus cells which are actually proliferating, these melanocytes. Okay, so beta, that's all about the morphology, the pathogenesis, and the entire concept of dysplastic nevus. Okay, so I hope this is very much clear to you. If you have understood, or if you have any question, you may ask to me anywhere, anytime. Okay, and if you like this, and if your concepts are very much clear with this, you can subscribe to the channel as well. Thank you so much beta. Class dismissed.